everyone, it's Felicity here from Banchory Spinal Health, and I'm here to do a little video today. And this is something that I get asked all the time, and it's been on my to-do list for a long time. Patients who have bought one of our Dr. Graeme Massagers ask me, Felicity, could you please show me how to use it at home? So now what I'm doing is I'm doing a video so I can just send this video to people instead of running through it all with everybody every time. Also, I know a lot of you have bought one at the moment because obviously a lot of us are working from home. A lot of you aren't able to pop down to the clinic if you need to because we've had to temporarily shut the doors. So again, it might be helpful for those of you who do have one at home. You can follow my tips. We have about 3 left, I think. So if anybody wants one and you are not too far away, we can get one to you. Okay, so just private message us, send us an email, and Vanessa will get that organised for you. So there's a couple of ground rules with the Dr. Graemes. Here's a Dr. Graeme. Just before we start, so the first thing is you are not advised to use a Dr. Graeme if you take any medications that thin your blood. So things like warfarin, anything that has a warning on it that says it's more likely to make you bruise very easily. You want to be very careful using one of these. It's probably not advised. If you aren't sure, just send us a message, get in touch with us and we'll point you in the right direction. We'll get you in touch with a practitioner or myself, and we can advise you from there. So yeah, that is a very, very big, just to make sure you know, we don't advise that you use it if you're on blood thinners. So the other thing you should not do with your Dr. Graeme is use it repeatedly on bony bits. That's a technical term. So the bony bits, you would have like a bony bit here. You have your knobbly bony bits all down your spine. These are called your spinous processes. So these bits here, you don't want to be using your Dr. Graeme on them. It's going to be sore, so you'll probably stop anyway, but it's just not advised. You're quite likely to bruise. It's just not going to be nice, so don't do that. This is why, if you're using a Dr. Graeme, you should only really use it on yourself, or somebody trained like me can use it on you. But sometimes if you're doing it on other people, you might not realise, if you're not trained in anatomy, you might not realise where the bony bits are, and we don't want to cause any problems. So yes, that's just my little disclaimer at the beginning. So I'll just show you quickly how it works. So this is the Dr. Graeme. This is the bit that goes on your body. There's a wire and a plug. It's quite a long wire actually. And this is the button that turns it on and off. And this is the intensity, okay? So you just slide it up and down like this. I'll just turn it on so you can hear it. So that's higher intensity, and that's lower intensity. Now, something I always get asked is, when do I use higher intensity and when do I use lower intensity? So the answer is basically it doesn't matter. But if we're being really pernickety about it, the higher intensity, so like this, creates a vibration where the wave is shorter. So obviously we're told to use it on muscles that are shallower, so they're not as deep from the skin. So that would be, we're going to go through muscles kind of individually, but that would be maybe your shoulder muscles, the ones that you can feel more easily. And the lower frequency, right, like this, is for deeper muscles. So that would be more your leg muscles, your glute muscles, anything around your butt is a bit deeper down into the tissue. So you could use a lower intensity, but honestly, it really, really, really doesn't matter. Just anything is fine, but if we're being official, that's what I'm saying. So there's tons of different areas on the body that you can use this, but remember, no bony bits, so no on your face or your head or anything like that. But I'm just going to cover the most common ones and the ones that I suspect will be needing some work with all of us working from home and all of that stuff. So, oh, that was the other thing, the heads. So your Dr. Graeme Massager will come with 3 different heads and they screw on and off like this. Very, very simple. Okay, so I'm just going to quickly talk about the 3 that it comes with. So, if you are a beginner, you start with this one, nice flat. See, this is one of the clinic ones and it gets a lot of use, so that's why it looks a bit grubby. Yours will be lovely and clean and shiny. So, yes, so this is the one I would always recommend that you start with. I most frequently use this one because it just gives a slightly deeper outcome with this one. This one and this one will both be fine. But I think just while you're getting the hang of it, just in case you hit a bony bit, this one is the softest. So just start off with this one, progress to this one, okay? You also have this one, okay? And the difference you can hear versus this, maybe you can't hear it. This one is much harder, okay? So I would only use this one on quite a deep muscle, depending on the size of the patient. If there's a lot of tissue to get through, I would be possibly using this one. Or if it was a really, really stubborn problem and I needed to be a bit more firm, I would do this as a last resort. But I would warn the patient, this is going to be very uncomfortable. Honestly, if you're doing this on yourself at home, I would just leave this one. Just put it back. So this is my favorite one, so I'm going to use this one. I'm going to screw that one in. Okay, so there's kind of 4 or 5 main areas that we're just going to focus on. So the first one, without a doubt, I would say in my experience, maybe 90% of the population would have tightness in these muscles here. These are called your upper traps, your upper trapezius muscle. So on your back, you have a huge muscle called your trapezius because it's shaped like a trapezoid, like a kite basically. So it's shaped like that across your back. And these upper traps notoriously get very, very tight. So part of the reason for that is because when we're sitting at a desk, we're like this. And part of the reason is when we are stressed and our body goes into a fearful, stressed state, harking back to sort of more primitive times where we were living in caves, your body senses that stress and goes, oh no, there's something we need to protect ourselves from, and it goes like this. So your shoulders start raising up closer to your ears to protect your neck. So say you were being chased by a bear and the bear tried to claw you. If they clawed you on your shoulder, it would be sore, but you'd survive. If they clawed you on your neck, you'd be dead. So this is why your body does that. However, nowadays, very few of us get chased by bears, and the sort of stress that we have, it doesn't really require this, but our bodies do it anyway. So we have this low-grade stress all the time, which I'm sure a lot of us are feeling just now. So I'm really gonna focus up here. So all you do, put your machine on, and I'm gonna put it on high intensity. You can hear it's on high intensity, just because it's a muscle that's closer to the skin. And that's about it. So you wanna just put it there and down. So I'm just rubbing it up and down. Really simple, okay? Another thing you can do if you're feeling really clever is you can hold it there and then just turn your head one way and the other way. If you feel like the high intensity just feels a bit jiggly, like on your ear, just bring it down. It's not a big deal. You've just got to find the one that works for you. Okay, so that's one side, then the other. Please don't feel like you have to push down with this. The point of this is that it's heavier at this end, so the weight of the machine will just do the work for you. When I'm doing it on people, occasionally I will apply some extra pressure, but I'm a professional and I feel like I know sort of what patients can tolerate. I think if you're doing it on yourself, just use the weight of the machine, don't worry about it. So again, you can just turn your head. Now people ask me, how long should I do this for? And it kind of doesn't matter. If you did a minute each side once a day, you would definitely notice a difference doing that. Gauge it by how bad you're feeling. If you're feeling really bad, you can do it every hour if you need to. It really doesn't matter. So, top of the shoulders are a must. Anybody, anywhere, chances are they're going to be tight. Anybody with neck pain or headaches, definitely get this on your upper traps, because your upper traps, when they're really, really tight, they can refer pain up the neck and around to the back of the head. It's where a lot of tension headaches come from. It's where a lot of cervicogenic headaches come from. So do get that done. Another thing that a lot of us are going to start getting over the next couple of weeks is problems with these muscles here. These are called your rotator cuff muscles. This isn't really an anatomy lesson, but just so you know, these are the rotator cuff muscles. So these are slightly more tricky, but you know your rotator cuff muscles are not right if you start getting like a weird kind of tingly, sort of dull, achy feeling like in your arms, sometimes in these parts of your hands, or you feel like your shoulders are sore but you can't pinpoint where, might be your rotator cuffs. So same again, your rotator cuffs are slightly deeper, so I would have it maybe somewhere in the middle. Again, it doesn't really matter. And you just lift your arm up like this and do that. Yeah, I'm feeling that. Can you see where it is there? Again, if you're feeling really clever, you could do that whilst holding it. Again, a minute or so should be good. Now, do be careful because your scapula sits around here. If you go back too far, you'll hit a little bony bit. It won't be too bad, but you'll feel it. Okay, that's your rotator cuff. So those are the two main ones that I would be focusing on, the upper body at the moment, especially if you're working from home. Now for the next one that I'm dreading is the lower half of your body. So what a lot of people are also going to be feeling is their lower back. So you have to be very, very careful here because you're going to be close to these lumpy bits, your spinous processes here. So what we're trying to do is work on either side of those. So I'm going to see if it's the right angle here. All right, so again, doesn't matter the frequency. And this is the middle of my spine here, so I'm going to go to the back. So I don't know how well you can see that. So I'm just running up and down. These are called my erector spinae muscles. They're just the muscles either side of my spine, and they're really going to feel it if you're sitting all day. And the other side. Okay. And the next one is your glutes and your piriformis muscle. The reason I'm dreading this is because it's basically just your butt. So, so here you go. So there's a few different ways you can do this. But honestly, the best way is to try and lift your leg up on something and just do it like that. Can I believe I'm doing this on video? No. So the best thing is to find a bit that feels uncomfortable and hold it there. That usually means you're on the right spot. And honestly, there aren't many bony bits around that area, so you can't really get it wrong. Another great thing to do, especially if you've got sore thighs from doing your Joe Wicks morning PE, is just to run this up and down the front of your legs. So if you feel any stiffness in the legs from sitting all day, I quite often do this. Just run it up and down, and that'll just feel really, really good. Just energize your legs a little bit more, break up any adhesions in the muscles, and really the best place to do it on your legs is your hamstrings. Slightly more tricky, but again, really, really important to get them loosened off. There's kind of no easier way of doing this than just sort of standing up and getting it done. Just running it up and down. Have to balance that out with the other side later. Okay, so I hope this has been helpful. A lot of it with Dr. Graeme, it's perfectly safe, you can't really do it wrong. But those are just my top tips for, you know, an easy, you know, the whole thing would take you maybe 8 minutes just to do those main muscle groups. And I really feel like you would notice a big difference if you did that once a day. So a lot of people ask me, how long do these Dr. Graemes last? And I don't think they've got a specific guarantee on them, but just to give you an idea, so I've had one, so my clinic's now 8 years old. I had one I changed it just before we moved, and I think we moved when we were 5 years old. And the only reason I changed it is just for some reason it went really, really loud. And it was just really annoying me that it was so loud, so I just changed it for another one that was like whisper quiet. But it was still fully functional, perfectly fine. So, and these get heavy use in our clinic. They get used multiple times a day, 6 days a week. So I would be very confident in saying there's no reason why this couldn't last you the rest of your life. They do have a disclaimer on the box that says don't use for more than 15 minutes at a time. And I think that's just because they're worried about them overheating. I don't think I've ever used one solidly for 15 minutes, but obviously ours get used, you know, repeatedly, appointment after appointment. So I think the chances of it overheating are very low, and I think that's just something they say. I hope that's been helpful. So if you've got any other questions about the Dr. Graeme, please post a comment, post a question, do let us know what you think. And yeah, I'll see you soon. So as I said, the clinic's temporarily shut because of the COVID-19, but we'll be open soon enough. If you'd like an appointment, it's 01330 8240 40, or email us at info@banchoryspinalhealth.co.uk. All right, thanks guys.